Hi there, this is Joel Steinberg from Diabetes Transformation. I'm a type 2 diabetes coach and I have been for almost 4 years now. I'm 74 years old. I'm just beginning to do it on social media. My original thinking was that since I'm 70, well, I was a little over 70 when I first started doing this. My original thinking was that social media was more for younger people. But I've come to learn that a large percentage of my clients that I help, even without social media, are in their 40s and 50s. Diabetes is a very difficult disease. It kind of sneaks up on you. The tricky part about dealing with type 2 diabetes is that when you first start getting type 2 diabetes, you don't realize it because you don't have any symptoms. Then you may start urinating a little bit more, or you may get a little bit sleepy, and it kind of sneaks up on you. At the beginning, like most people, my thought was I never want to take any medication. I think I can handle this on my own. I kind of knew that I was going to have diabetes because my dad had diabetes. I had a real sweet tooth. And I used to check my blood sugar when I would visit him, and I would notice that it would take a long time for my blood sugar to come back to normal. Which gets me to the first point that I want to make. And that is there are basically two ways that you can check your blood sugar. One is with a meter and pricking your finger and checking your blood sugar. I did that for years. I now use a continuous glucose monitor. My insurance covers it, and more insurance companies are covering it, even for type 2, people with type 2. At first it was only for people that were insulin dependent. I am not insulin dependent, and my programs are geared mostly for people who are not insulin dependent, because frankly, since I don't take insulin, I don't know that much about it, and I don't feel competent to learn about it. A few of the things that are important to know about type 2 diabetes are how do you know you have it, and how do you control it, and what is reversing diabetes. Those are some of the subjects that I'm going to talk about in this video. This video will be a little bit longer than many. First, how do you know it? How do you know you have it? Well, you can check your A1C. You can check your A1C by going to a doctor, and I strongly encourage anyone who has type 2 or believes that they might have type 2 diabetes, use an endocrinologist, not an internal medicine physician, or not a general practitioner. The reason I don't recommend a general practitioner is that I'm not confident that all general practitioners follow the appropriate protocol to determine when they should use meds and if they should use meds. I'm a strong advocate of starting off trying to control your diet, and eat healthy foods, exercise regularly, reduce your stress, do physical exercise, do steps, do all the things you can to try and control your diabetes naturally. I'm mostly talking about type 2 diabetes now. In many ways, it's very different than type 1 because you're not taking insulin. Sometimes type 1 is more difficult because you're dependent on insulin. In type 2 diabetes, you're not dependent on insulin, but the problem is that it's a little bit trickier for you because you can get away with eating things and not worrying about taking insulin, and you may not know that you're raising your blood sugar. That's why now I am a very strong advocate of continuous glucose monitors. It's a little patch that you put in your arm, and you can check it on your cell phone. You can check what your blood sugar is regularly on your cell phone. I use one. Now I want to talk to you a little bit about A1C. A1C basically has three aspects to it. One is the actual A1C. You can check your A1C at the doctor's office, or you can actually buy an A1C checker at the local CVS store or the Walmart store They cost about $40 or $45 for 2 checks. My experience is that they're pretty accurate. I've actually tested them. I personally consistently keep my A1C at about 5.6 to 5.8. I don't try and make it any lower, and I try to keep it under 6, although it's okay if you have type 2 diabetes and you consistently keep it at a level of 6.5 or lower. I do take medications, and I'm going to discuss medications a little bit here. But so the first part of A1C is checking what your blood sugar is. The second aspect of A1C is time in range. Now, your blood sugar is different if your A1C is, say, 6.2, but sometimes it's really low, or you might even have hypoglycemia or low blood sugar, and other times it's really high. It's much better if you keep your blood sugar at a consistent range. When you have a continuous glucose monitor, that's between 80 and 180, or the European method is 4.4 to 10.0. You want to try and keep that within that range at least 75% of the time. If you're not within 75% of the time, you may have a 6.5 A1C, but it's all over the map. And so therefore, it's not as effective, and you don't really have control of your type 2 diabetes. The third thing is glycemic variability. Glycemic variability has to do with, it's almost like checking yourself and seeing how much time you're within time of range. So if it's all over the map, it's not good. So if in the morning it's 70, and in the evening it's 300, you're better off with less variability. You don't want a roller coaster effect. You want to try and keep your blood sugar within that range of 80 to 180, 75% of the time. So those are the goals that you want to achieve. But an important part of dealing with type 2 diabetes at the beginning is not to make radical changes. I read online, and I'm a little bit concerned about what I read online, because people are talking about reversing diabetes. You really don't reverse diabetes. You can control diabetes, and you can put diabetes in remission. And some people, rare people, can keep diabetes in remission for years and years, but that's rare. Many times people who are, quote, reversing diabetes when they first learn about the diabetes and they start practicing it, they go on a radical diet, they lose weight, and they lower their A1C very, very quickly. The problem there is that they're not really changing their habits, and they're not changing, and they may be changing their diet radically in ways that they're not used to and that they won't keep. I'm a strong advocate of letting your yourself lose weight gradually, and letting yourself gain control of your A1C gradually. So if you go from an 8.0 A1C today, and then you go in 6 weeks, you're at a 5.0. Well, that sounds great, and you may think that you've cured your diabetes and you've reversed your diabetes, but I doubt it. It's more likely than not that you'll end up getting back to your old habits, and you'll probably end up with getting back to higher A1Cs. It's much better. There are a few other things that I want to encourage you to do. One is at the beginning when